Hi, welcome to Health 101. I'm Dr. Michele. I'm a board certified physician bringing this house call to you. Make a fist. Everyone, make a fist. Big, strong fist. Take a look at it and relax. Mine may be a little bit bigger than yours. Yours may be a little bit bigger than mine, but your fist is roughly the same size as your heart. Your heart does a lot of wonderful things for you. It keeps the beat, it pumps the blood. Your heart doesn't take vacations. It works 24 hours a day, 7 days a week, doesn't take breaks. Your heart definitely doesn't take smoke breaks. If we took my heart rate and I took your heart rate and we took the heart rate of a trained athlete, someone who plays basketball, an NBA player, someone who plays football, an NFL player, and a marathon runner, would the heart rates be the same? What do you think? What's the answer? Well, all that training they do, running, jumping, hours, days, weeks, months, years, it trains their heart. So their hearts pump more efficiently than yours, more efficiently than mine. They get the job done in fewer beats per minute. Their heart rates are much slower. What's a heart attack? Everybody knows somebody who's had a heart attack. What's a mild heart attack? What's a light heart attack? Some people have had many heart attacks. What's that about? Well, a heart attack is damage to your heart. So people who've had a light or a mild heart attack, they've had a small amount of damage to their heart usually. And people who've had several heart attacks, they've had a lot of small areas of damage to their heart. Each year, 1.1 million Americans have heart attacks. 650,000, it's their first heart attack. The rest, they've had heart attacks before. So we're talking about heart disease. It is the #1 killer of men and women in the United States. We're going to talk about risk factors because if we know what our risk factors are, we can lower our risk. So this show is for you. In the first part of the show, you want to learn two things, two new things or two things that you kind of knew but you didn't understand as well. And in the second part, you want to do two things that are different that maybe you thought about but weren't motivated to do. You want to learn two and do two. Now, I know some of you are saying, can we just learn one and do one? Listen, if every American family learned more and did more about their health, we could shape up an entire nation. So we got to double down on this. Learn two, do two. Let's get started. Are you ready? I am. Did you ever play cards and you get a hand and it's a wonderful hand? You know you're going to win. It's a great hand. Did you ever play cards and you got a hand that you thought it's going to take every ounce of skill I have to get through this because it wasn't a good hand? It's like that with risk factors. Everybody has a certain risk factor. We're actually going to go through a list in a minute. But you need to know exactly what your risk factors are because how else do you know what to do about them? That's the goal, to know what they are so that you know what to do. All right. So I'm just going to go through a whole list of them. And this is not rocket science. You know this. You've heard these risk factors before. It's all going to be familiar to you. Obesity, family history of heart disease, high blood pressure, diabetes, elevated cholesterol, smoking, eating fatty foods, rich fatty foods, stressors, sedentary lifestyle. Okay, so now this is not news to you. You've heard this before. Let's talk about sedentary lifestyle. What the heck does that mean? You've heard that. You've seen it in the papers. You've heard it on television. Do you know the woman who drove to work, parked as close as she could to the building, went inside, sat down at her desk, worked all morning, and then someone came by and said, I'm picking up stuff for lunch. Do you want something? And she said yes. She goes to the break room, sits down, and eats her lunch. And then she goes back to her desk, works to the close of business, and then gets in her car on the way home, goes through the drive-thru, her favorite fast food place, picks up dinner, goes home, eats her dinner, and then sits down on the sofa. and watches television until she's tired, and then she goes to bed. Do you know that woman? Are you that woman? Is your sister that woman? Is that your mom? Is that your aunt? Is that your neighbor? Are you that woman? That is a sedentary lifestyle. What does she need to do? What needs to happen? She needs to exercise. A sedentary lifestyle is a physically inactive lifestyle, and it is a risk factor for heart disease. What's the best exercise to do? What kind of exercise should you do? Well, what do you like to do? What can you stick with? If you want to skate or bike or run or walk or swim or play tennis, whatever you like and will stick with is what you should do. If you haven't exercised, if you can't remember when you've exercised, you need to see a doctor. But if you used to exercise and you kind of slacked off, get started. If you can only do 10 minutes, that's fine. Do 10 minutes 5 days a week. Maybe in 2 weeks you can do 10. Maybe in 2 weeks 15. This is not a race. You're trying to make a lifestyle change. But get moving. It matters. It will lower your risk of heart disease. Stressors. What am I talking about? Well, your mind and your body work together. So this is a difficult time in our country. So many people are stressed out, overwhelmed, anxious, nervous, don't know what to do, going through something. If that's happening to you, it increases your risk of heart disease. So you have to take care of it. You can talk to your clergy, your rabbi, your minister, seek the help of a trained professional. But you have to do something about it because it increases your risk of heart disease. Food. Fatty foods are on the list. People ask me this more than anything else. What should I eat? What should I eat? I think Americans are changing the way we live. We are rushing around. We're working more. We're working second jobs. We're working extra hours. We don't think a lot about what we eat. And we don't have time to prepare it either. So we're kind of rushed. So our whole food intake is based around convenience, not health. So what's the answer? The answer is we should eat more fruits and vegetables. But it's not just what we eat. It's when we eat it and how we eat it. When I was growing up, I spent a lot of time with my grandparents, and they ate differently. Everybody ate breakfast. Lunch was a huge meal with lots of vegetables, rutabagas, squash, broccoli, cauliflower, lots of vegetables. And dinner was a snack. And after dinner, you could have a fruit for a dessert. So today, many of us skip breakfast, a lot of us skip lunch, and dinner is a big, big meal. So that's not the best way to do it. So it's not just what we eat, it's how we eat it. So we have to factor that in as well. The other thing is many of our snacks turn out to be very high calorie. So having a snack is not a bad thing, but it depends on what you're snacking on. So this food thing is really a big subject, and we could talk about it a lot because there's a lot of room for improvement in our diet. But get started. Make small gains. You can try with healthier snacks. You can try changing the timing of when you eat. You can try adding a few more fruits and vegetables. There's lots of ways to do it. And the best thing is to just get started. Smoking. Do any of you smoke? It increases your risk of heart disease. This is the best time to stop smoking. There's so many ways to stop smoking today. Everybody knows about the nicotine patch and the nicotine gum, but there are other ways. On average, people will try 7 times to stop smoking before they stop. So if you tried 1 or 2, you got more times to go. So stop smoking. We'll be back in a little while to talk more about risk factors. You won't want to miss this.